Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Amber Price, who is the Senior Vice President and Chief Nursing Officer at Sentara Health, about how the night shift crisis is being solved by a new training program at the health system. So, hi, Amber, how are you?
Doing well. Thank you so much.
Of course, and it's good to see you again, and thank you for taking the time. This is a really interesting conversation that we're going to have today. So just to frame it at the top, what are some of the unique challenges that CNOs are trying to address for nurses on the night shift?
Well, I think the first one we all feel, and that's just making sure that our staffing is optimal on the night shift. Our resources go down. And so we want to make sure that we have a balanced mix of nurses and that we have a steady staffing level so that our patients are getting the care they need. In addition, we see more turnover on the night shift. Many people start there and want to move to day shift. So we're always preparing to bring more people on for night shift. We also see a different skill mix. We see more new graduates on the night shift who may have more need for support. And so all of those things combined can make it challenging to keep that shift staffed.
Mhm. Absolutely. So tell me about Centara's new training program for the night shift nurses. What are some of the goals of the program and what are they going to be learning?
Well, one of the things we often hear is feedback beyond basic things like not having resources in emergencies or not having supply on site, for example, is that they feel the lack of an educator. There's often not an educator on the night shift. And so what we're teaching our night shift nurses is that we've launched a new tool for overnight support. They can pull up a virtual seasoned nurse throughout the entire night shift for whatever they need. And the learning with that has been really interesting. We anticipated it being mostly new grads asking about things that they didn't quite know how to do, but we're learning a whole lot more on how that's utilized. And so from the start of their tenure with us, they know that there's a partner with them on that night shift. There's not always availability of a mentor because we have fewer people in the hospital. And so this has created an opportunity to be able to have a thought partner with you at all times while you're working, and that has seen really promising results.
Absolutely. So what's really the value of that mentorship for those nurses on the night shift?
Well, I think there is an innate feeling, and I hear this, anytime I round, that, you're always a little bit more nervous when you know there's not a whole lot of people there to help you. And
Mhm.
so we're trending to see how these virtual nurses are being used. We call our program Nurse Connect. And the way it works is that a nurse can just request any kind of support. Those That pool of nurses is located in a central location. All of those nurses have more than 5 years experience and their experience is varied. So when a specific request comes in, we pair that request with the right person who happens to be there. So if it's somebody in an ICU, it's going to be an ICU nurse, right? If it's a med surg nurse, we have those experts on as well. And so you're first of all paired with somebody who's an expert in whatever it is that you're asking about. Um, what we're seeing is that often they're utilized as a thought partner. I think on the day shift, there's lots of people around, and you can go find somebody, and your manager's there, and you can just say, hey, what do you think of this? And we're seeing it used for that. We're seeing questions like, hey, do you know what the policy says around this? Because you're standing in the patient's room and you may not be able to go out and go figure that out. Or, hey, I'm trying to figure out this order and it seems, these two things don't seem to make sense together. Can you help me think through what they're asking? Because there's not a physician immediately available to ask either if it's a complicated order. And we're learning that it's not just our new grads, it's our seasoned nurses. I think the hallmark of nursing is that we don't do things in isolation and that we're always learning, and we do enforce that we are a learning organization. And we're seeing people reaching out to their peers, even when they're seasoned, to just say, hey, can you think this through with me? And we really have appreciated that. What we like about it is that we're normalizing asking for help.
Mhm.
And that is exactly what we're seeing happening. This program continues to grow, but we're certainly seeing the greatest utilization on the night shift.
Mhm. Absolutely. And you said they're virtual nurses, so what's the technology kind of setup look like for that?
Yeah, so as I said, we have a large virtual hub. It's a separate facility where all of our virtual functions are located. And that includes virtual sitters, it includes our EICU nursing team, and it includes our virtual nursing team. So they also have each other as resources as well when they're working at night. In the room, there is a camera. The camera is a regular camera, but it also functions as our AI. So it can also detect patterns in the room and do early alerts. And then there's a large television screen in the room as well, where somebody can pop up, life size and to the patient that feels like that person is in the room with them. We do tell our patients about this technology so they know that this is an extension of our nursing team, and that this is how we provide nursing care in Sentara. So that's how the setup works. The nurses use their regular medical record to ask for this, and they can be pretty specific about what it is they need and want so that immediately the right person pops up on that screen and can offer immediate assistance.
Mhm. Absolutely. So do you have any outcomes to share so far, or any reactions from the nurses?
Yeah, I mean, there are a lot of interesting things. The nurses can also start ideating. And so they
Mhm.
come up with ideas and they come up with pilots of other things that we can use. And so, in partnership with this, we've also launched on some of our units a night shift virtual nurse who does all of the rounding so they don't have to open doors and wake patients up and turn lights on because these are night vision cameras. And so, we're giving them some time back on what could be a very busy shift with fewer staff members around. And so they actually have a bit more time on their hands as well. So one of the things we're tracking is time back. We can also track how much time we're now spending with our patient versus how much time we were spending before. And that is an ongoing tracking. Nurses have a defined workflow. And when suddenly there's more time in your shift, your first thought isn't to change your workflow. And so we're really encouraging to give that time back to the patient. We often hear that nurses were distracted because people wanted to have a conversation and chat, and now they have time for those conversations. Nurses love providing phenomenal care to their patients. They love being able to sit with people. They love being able to hear a bit of their life story. And so the well-being of our night shift nurses is changing because they are able to focus more on their patient. There's also a significant amount of anxiety when there's something really complex and there's nobody to ask. And so what we're seeing is more timely care because in the past they would have waited until day shift came to complete something. We recently had one of our Nurse Connect virtual nurses walk a new grad through peritoneal dialysis, something she had not done before, and that went off perfectly. And again, we were able to match with somebody who's an expert and was able to seamlessly talk that nurse through that procedure. That builds confidence. You're able to immediately do something and learn a skill in what feels like a very psychologically safe environment. I think what we're learning is that when nurses first come off orientation, and your preceptor is somewhere nearby on the floor, it feels like you weren't paying attention the first time they explained and you have to go find him and ask him again. This
Mhm.
is a complete stranger to you, somebody who's working externally, and it's in the privacy of your room. So it is way easier to ask a question and not feel, like somebody might judge you for lack of knowledge. And so I think we may be seeing more collaboration than we've seen even on day shifts where we have more people available just because it's done in a psychologically safe environment.
Mhm. Yeah, that's great to hear. So for CNOs who might want to take a similar approach, do you have any recommendations on how to get started?
Yes, I mean, you've heard me say this before in prior interviews, but you begin with your nurses. And what we actually did is go to a night shift team on our busiest med-surg unit, and we said, if you had a virtual nurse, what would they do for you? And
Mhm.
those nurses ran with it and gave us some really good advice. There are not really any great national benchmarks yet of what the workload of a virtual nurse looks like on the night shift. So if you're including a virtual nurse on a night shift unit, one of the things they're going to want to do is rounding, so we don't have to wake patients up. But how many patients can one nurse round on if they're also doing other things that they thought that they should do, like take a report from the ED or take a report from the OR? And so we're learning what that looks like. We can also rotate nurses through. So if we add a virtual nurse to the floor, in addition to that virtual center, it changes the way that we're doing things, but they can also take turns taking a virtual shift to support their peers and team members, we're learning very rapidly that virtual nursing has a very low nursing turnover.
Mhm.
For us, that turnover for virtual nurses is less than 2.7%. And so there's a huge satisfaction in being able to rotate through and do something different than being on your feet. It takes a toll on your body. It's difficult to maintain your critical thinking, and having what feels to them like a bit of a rest break in your week by being that computer person seems to be a big win for us.
Mhm. Absolutely. So then on a broader scale, I wanted to ask you about this as well. Something that I've been speaking to several other CNOs about recently in the industry is like clinical readiness, and kind of that confidence piece that you're talking about. So how can CNOs partner with their educational nursing institutions to really ensure that nurses are coming out of school ready to work that night shift?
Well, it's a great question, and it's where I'm spending quite a bit of my time. The nursing schools have not quite caught up with the fact that we are doing things differently in the hospitals because this is so new. And it's not just about them understanding that the support is there. Now that we're incorporating AI and ambient listening, nursing students need to learn how to speak their assessment out loud, and that is not being taught. And so we're changing the way we communicate, we're changing the way that we're prompting our AI to do the work for us and lighten our workload. And so we are heavily integrated into two of our local nursing programs. One of those is our own school, and then a large university. We can actually, through our normal Teams communication, get into the classroom and bring that reality right to the students as they're learning so they can ask questions. But the other thing that we're learning is that when graduates come out of school, there's often a bit of a shock as to how hard nursing really is. And so creating a better understanding of what to expect is absolutely crucial. When you know that there's support available in the position that you go in, it gives them a bit more confidence because they know that there's a way for them to get immediate support when they feel overwhelmed. We're also learning that the importance of graduates rotating through your facility while they are students helps prepare them for that. And so seeing those interactions live, understanding what a virtual admission and discharge look like, because they won't be doing as many of those themselves in the future, is incredibly important as well. One of the things we have to think about is how we continue to develop critical thinking and critical skills if some of those things are taken off the plate of the nurse. And so we're doing all of that and integrating that into the curriculum. There's a lot of enthusiasm from the schools on this as well. Everyone wants to prepare somebody who's going to succeed, and so the collaboration is very strong.
Absolutely. Well, thank you so much, Amber, for your time. I'm really grateful to have had this opportunity to hear your insights again. And thank you so much to our audience for listening. Thank you, Amber.
Thank you.